It's helped me to find myself again.
You know, it's sort of improves your life. So
we help people to get back into control of their health in a way that matters most to them.
You can see a change in someone's life. Their confidence grows, or they feel connected, or they just begin to see that where they started is not the end, it's the beginning.
We try and look at the whole person. That's the key, really. It's not just around the medical bits, which traditionally GPs and nurses and other healthcare professionals would do, but really looking at that social, psychological and life in general. How is that person's well-being?
When the GP suggested the health and wellbeing, I didn't really have any expectations at all. I went with an open mind, and I was pleasantly, amazingly surprised at how relaxed it was, how comfortable I felt, and I just felt I could just talk and be me, and it was the best thing I ever did.
So I can work with people that are struggling with feeling low, feeling anxious, but I also might work with people that are struggling with finances or struggling with isolation, or just not sure where to start to help themselves feel a bit better with whatever's going on in their life.
having had a blood test and being diagnosed with diabetes, so I went for several sessions there, and as I say, it was very, very good to go and see someone who could actually inform you about dietary issues, and then, as I say, on top of that, it was basically going out and getting some exercise, really.
We work with people. We have a longer appointment to start with, where we can hear a bit more from them about their current situation, what's going on. We'll look together at a wellbeing questionnaire that just helps highlight things that are going okay, things that you want to talk about a bit more. And then from all that, we will look together for resources. We can look for specialist services or support, or local groups, or we can look at goals to look at those small changes that can make a difference to how you're feeling.
Before the health and wellbeing sessions, I lost myself. I lost who I was. I decided that I'd go to work, I'd come home, and I'd lock the door, and that'd be it until the next day. Whereas now, speaking to the advisor, I've found that I am a sociable person. I should be more sociable. So I've gone out more, I plan things more with my friends, I've got a cat.
We often use the analogy of a ripple effect. So if we know that health and wellbeing is a huge area, and we know that if a person is to focus on one area in a positive way, it can have a positive impact on the rest.
And realise that that so many things can impact their physical health and their mental health, and that there are other changes that can be made. So I think it just helps both practice GPs, but also patient, realise that I am more.
I've made changes to make a better life, so I will be more sociable. I will, if I think, I'm not going to do that. No, I almost just force yourself a little bit, just to make sure that you're getting the most out of life.
Seeing patients who are having their lives transformed in ways that we couldn't just simply have done through the medical model, because we're tackling the root cause of their issues, as well as trying to support them medically. We are managing and helping support their wider life and relationships.